Hello, Dr. Tommy. It's so nice to have you on the show today. How are you doing?
I'm doing great. I'm doing great here in sunny Tampa, Florida.
Awesome, awesome. And I love that. And you see, Doctor, oftentimes I love to thank my guests for two things. And I do this so often to the point where it has become my anthem. So, firstly, Dr. Tommy, I want to say thank you so very much for investing in yourself. You see, you are on this platform right now because you did invested in yourself. And oftentimes, Dr. Tommy, I love to make reference to the amazing mango tree. They say some couple of months back, I was on a particular road, and just by the roadside, Doctor, there was this very tall, unattractive mango tree. And I used the word unattractive because the mango tree's got no mangoes on it, and the leaves were all dry. So I just walked past it and I went my way. But you see, Dr. Tommy, just recently, I was on that same road. And this time around, mm, a lot's changed about the mango tree, you see. The mango tree caught my attention pretty good from a distance. And immediately, I got the urge to move so close to it, of which I did. And it wowed me because now the mango tree's got a lot of mangoes on it. Beautiful green leaves and healthy branches. And not just mangoes now, Dr. Tom. I'm talking about ripe mangoes. It was such a lovely experience that day, and I was so, so excited. Here is my point. The fact that you dedicated your time, energy, and resources to becoming the amazing Dr. Tommy that you are today, that alone has made it impossible for me to skip you. And that's why you got the request from me to be on the show because I was attracted to the fruit of all that you're doing. Your philosophies, your journey, your work, your insights, the impact your work is having. This stuff's so beautiful. And just before I sent you that request, I said to myself, I've got to benefit from these beautiful things Dr. Tom is doing. And not only me now, because, I don't want to look selfish, and even with the audience. And here we are today with the amazing Dr. Thomas. So thank you so very much for doing that yourself. And secondly, thank you for saying yes to the invite. Because if you had said nope, there was nothing Elisha could do about it. Thanks so much, Doc.
Let me tell you that those are the kindest words I heard. I mean, you just made my day right there. It's beautiful how you use something in a pre and a post, and you saw the beauty that ugly mango tree produced. That was a great story. I mean, thank you very much.
Thank
And then
you.
everything you said about me. I guess it's hard to really talk about me because I'm not that kind of person, but you have to kind of acknowledge some things that I've done. But
Thank you.
I really appreciate that.
Thank you. And thank you for all that you're doing. Appreciate that too. So let's get started. You see, I'm quite excited to have you on the show today, Dr. Tommy, for some reasons. Firstly, my interest in knowledge seeking. I believe in order for one to transition from a terrible situation to that of a beautiful one, Doctor, I believe it takes the application of knowledge, quality information, and not just knowledge alone, but the application of it. And you see, Dr. Tommy, ever since I discovered that light in the Hebrew means knowledge and darkness, ignorance, I've been so keen to knowledge seeking. Why? Because I do not want to remain in the dark. So that's going to make our conversation today very important to me and even to the listeners. And the second reason why I'm excited to have the incredible Dr. Tommy on the show is for the sake of the audience. You see, Doctor, we live in an age where information is as abundant as grains of sand. We've got lots of information flying out there. So these folks trust me for quality, eye-opening, and very important information, of which I am totally convinced, Doctor, that our conversation is going to be insightful and impactful. So for that reason, Dr. Tommy, let's get started with your introduction. Talk to us about your personal or your professional journey, because right now we are so curious. We want to know how Dr. Tommy got here. And afterwards, I've gotten some beautiful questions for you. Okay, doctor, over to you.
Okay, a little bit of bio about me. Started off, I was pretty athletic as a kid and played high school sports that include like football, American football here, and baseball, and everything else I wrapped around there with basketball and all that stuff. So I went in the military, was in the Navy. I was fortunate to fly in the Navy. I was a back seat. They called us a sensor operator, and enjoyed my time there. Then I decided to follow my dad's footsteps and become a doctor. Now, he was a surgeon, and I wanted to do the invasive stuff. I apologize, the non invasive stuff. So that's why I went to the sports chiropractic side of things to match up to my athletics life when I have a child. So, follow that, and then got me to UCLA doc for these sports down there at UCLA with men's track and field, women's track and field, football, water polo, soccer, all these sports that were at UCLA, I was part of. And as these kids graduate and go into either professional or the Olympics, I tagged along with them and it got me introduced to that kind of level of sports. Then got involved with Olympic athletes, doing Olympic trials, and started working with that kind of caliber athletes. And then became the team doctor for the Tampa Bay Buccaneers here. And then as I'm evolving into this guy, I see that the most important thing is about healing and recovering. And it, from everything they use out there, and then you kind of go with that trend, which is regenerative medicine and stem cell therapy. So I've been in that stuff since 2005, from from the infant state of like prototherapy to PRP to where it's at stem cell, and it's all injectables. Seeing that, that this is the world that these pro athletes are involved with, you try to find out what are their pluses and negatives. And one of the negatives is that there's a downtime. And then, when you do an injection, the downtime is to recover from that injection. So they can't do the stem cell therapy during the season. So what they do instead is the pain medicine world, pain management. So I saw that if you can deliver something that's faster and not that bad of a downtime, then they will use that during the season. So that's why I developed a topical stem cell. So I developed a topical stem cell cream that you can apply and do the same type of delivery into that damaged tissue as the injections. So that was number one. And then after, you start doing this product, you start finding out that people have a lot of questions. So that's why I wrote a book. That book basically explains stem cell therapy, the theory, the mechanisms, and how it actually do what they're supposed to do, which is signaling your existing tissue to turn on to regenerate. So that's the evolution of me right there, from all the way from, high school, military to UCLA, and then into the world, professional world, and now developing and being an author.
And I tell you, that's an interesting evolution. And thank you for what you're doing now. It's amazing. So before we talk about your book, I want to understand something very well. So you used the word regenerative. So what is regenerative signaling? Got it?
Yeah, so regenerative medicine by itself is basically you're just trying to just turn on your cells to reproduce. If you have a damaged tissue, you want to regenerate to get new tissue to replace the old damaged tissue. So when you think about what you need something to start the process. You need a signal, right? Something that says turn on. Well, that's what that's all about. It's a signal that you have to tell your existing tissue turn on to regenerate, to turn on to multiply, to duplicate, do something. So as we're young at this age, well, not this age, but in your teens and 20s, you have a large signal that can tell things that, like a tendon, muscle, that if I'm damaged, turn on to regenerate. As we age, those signals start to, decline, and we start losing that signal. So we need something that gives us an ability to signal that will replace that old signal that we have. So that replacement is a form of stem cells, and it's what they call the EVs, what they secrete out. And that signal tells our existing tissue to turn on to regenerate.
I just learned something new, and that's amazing. So how is this different from stem cell therapy?
Okay. So stem cell therapy currently is You take a tissue, so you get a donor site, like a tissue from the umbilical cord called Wharton's jelly. Wharton's jelly has this cell called the mesenchymal stem cells. That cell is responsible for that type of large signaling for our bodies to regenerate. There's many things in there, like just like proteins, cytokines, microRNAs. There are all kinds of information in there that tells tissue to do something. Well, the neat thing about stem cell therapy now versus what they do now as a signaling is stem cell in the old days, they would think about like live cells. They want live cells in you. Well, live cells basically it's nucleus and it's supporting items inside the cell. Well, when you put a nucleus that has, the DNA and chromosomes, well, and it's alive, and you put it into your body, well, that's going to reproduce as something. You don't know what you're injecting. It can turn into like a hair, bone, eyeball. I don't know what's going to turn into, but it has its own codes. It's going to turn into that. If you can eliminate that component, which is the DNA and the chromosome and the codes, and just get the signals, that's where it's important because you reduce the chances of tumor formation. And more importantly, now you have something that's smaller and it's easier accessible because our body right now uses signals from a hormone sense. We have an ability to turn on tissue based on that signaling, just like what we're looking at. And that's through a endocrine system. We use it in a cell-to-cell communication called paracrine system, cell-to-cell communication. A little closer, of course, but the neat thing about it is the same concept. It's just that we're introducing to a stronger, better signal. And that could be in the form of that source from the umbilical cord, Wharton's jelly, or it can be from somewhere else too. That's going to be as strong as that signal. So that's what the beautiful thing about this. Find that signal and then target your existing tissue and wake it up.
And wake it up. Amazing. I tell you, this is some vital information. Wow. But I feel like stem cells are being misunderstood in medicine. I stand to be corrected, but what do you think about that?
Like I said, so when people hear the word stem cell, they think stem cell, okay, great. I can take this cell that's going to be from somewhere else and then put it in my body and it's going to somehow mutate into my tissue. It's impossible. There's no way that that chromosome and your chromosome are going to match up perfectly to make that perfect tendon, muscle, bone, cartilage, whatever you have the damage at. So that's the misconception is that people think that that cell, you need live cells and 10 million of those cells to go into your body and they're going to turn into it. No way. Now you take the other side of that, which is a signal. So that when they secrete that little information that's going to turn on your existing tissue, that's what regenerative medicine. That's what stem cells is really about. It's the mechanism of the secretion and the signals that secrete from there to target your existing tissue to turn on. So here's the thing that we all know. Our body, after we get, an adult stage, right? So we're at like 20 years old. We always make cells and we break down cells. We always have recycling, right? We always have that 1-to-1 ratio. We tear down a cell and we replace that cell because we want fresh cells. So we want that 1-to-1 ratio. So we need those things like adult stem cells and those other tissues that help that ability to recycle. As we get older, the signal decreases. Now the ratio of destruction is more than the actual rebuilding. So now we're like building one, but destroying two. Then we're building one, destroying three, because the signal is not
Wow.
strong to keep that 1-to-1 ratio. How do we find that signal? Well, again, we need to find it from a source that has that strong, youthful, large signal that tells our existing tissue, hey, this signal is here. Let's go and start working. Because we kind of sit in a dormant state. We're just sitting there, just kind of waiting around
Mm,
to have this information. And if the information's not there, well, it's not going to do its job. So that's what all this stem cell regenerative medicine, it's all about that particular information that you're going to introduce to your body to tell your body, do this.
wow. I feel like you took the right step writing that amazing book because questions would always pop up and you just created that to solve it all. I got that. So how was the writing process like?
To be honest, awful. It was awful. I mean, the first thing you do is just basically you start off with that outline and then you kind of have an idea what you want to talk about. And then it changes. Every time you get on the computer, it changes. So it started off like 6 chapters and it kept on increasing. Oh, I got to talk about this and how am I going to explain? I'm not that kind of person that really can like hone down and write a book in 3 weeks, 4 weeks. This thing took me almost a year and a half to write.
Wow.
Because as you go through the process of researching and then, understanding how to answer questions in a scientific way, but also talk to the normal person. So the book really talks to two people. There's a science side of it where it has, data points. And there's the other side where it gives you the layman's version of it. So the book's about like discovering stem cell and regenerative medicine. So I put a person named Jeff. Jeff is a good friend of mine, and he's discovering about his knee injury and then discovering about what stem cell and then the whole evolution and where it's at and where the future is going. So you have that side of it, but then also follow along with the actual like, science of it. So going back to the book, yeah, it was difficult. You have to be very I just know that you gotta sit down and you've gotta dedicate time and just apply yourself and go. So my first steps were madness. It was just put it on paper. It doesn't matter where it's going. It just stick it in there, make an outline, just stick stuff in there. And then phase two was the organization, organizing the
Mm,
layout and how you want it. And then collect the data. Ask the questions as much as possible. Like, I had so many questions that they were so easy to kind of like, fulfill the book
that,
because I would get those questions. So I got to answer that, answer that, answer that, answer. So I'm constantly throwing questions in there. So then you kind of like lay it out. And then it's almost like I had papers everywhere where I'm a tactile person. Some people can just do things based on just like visualization. I got to feel it. So I have paper all over my desk and I'm shifting my paper left and right. Like, this is chapter one. This is chapter two. I need to put this in chapter one and then spread it
wow.
out. Let's make a chapter four. So then now I'm visually and feeling everything. So I got it. Great. Now it's time to fine tune it. That's where you know, it's not I think once you get the layout and you feel where the book has to kinda, like, move and kinda, like, just kinda get the reader walking through from the actual, like, the questions, and then you get answers in the middle, and then have them walk through the whole process. Once you get that idea, the data is easy. You can always find
Right.
data. Just support your information, just continue on, and through the process, you'll adjust here and there. So that was a fun one. So for those of you writing a book, fiction book, that's fun. I bet that's fun because you're just going off of just your own thoughts and
True.
memory, and then there's probably some facts you have to pull out. But you're just
Yeah.
basically, you listen to these authors. There's some great like how would you say information and advice from authors that talk about uh, writing a book, just they call you a pants writer or something like that. You just sit down by the seat of your pants and just write, and no like organization, just write what you feel, and then from there you can come back and clean it up. I tried that out, and I'm a combination of that and the organization side of it.
Amazing. Like you said, it was difficult. But one thing that I appreciate about the whole thing is the fact that on the long run, you wrote the book anyway. So that's inspiring. And thank you for doing that. So we have one more to go. Okay. So what problem were you trying to solve with regen? Is it regen?
Yeah, yeah, Regen. So that's that topical stem cell cream that I developed. So the problem that I saw was the injections. Not only was it just the injection, but it was the cost. So you have to go to a provider and the provider, a doctor, and then they have their cost. Then you have to go to a facility and then that has a cost. Then you have to have a clean area and then, overhead cost, cost, cost. And then now the injection or the therapy would cost five to $15,000 per site. And that will push a lot of people out of that kind of realm. And I think like, well, you know, number one, you want everybody to be involved with this. Everybody should have the ability to, do this topical or I'm sorry, the stem cell therapy. So that's why through the process of, helping athletes out, I said, all right, we need to get something for these guys to have no downtime and they can apply it during your season. So you got to eliminate the injection. And then I started thinking about a cream, a topical cream that has a transdermal agent that can pull through the skin. And now it can do the same type of signaling just like injection. So once that got in there and I got that developed correctly, now your cost goes down a lot. So now we're at a point where it's affordable in aspect of human tissue cost, right? Now, here we're going to evolve eventually down to some other sourcing that's even more cost effective. And it's going to be better for people to get involved with because right now, regen is sold to the doctors and then they dispense it out to the patient. So it has that layer of protection with the FDA. Well, the next
Uh-huh.
line that's coming out, it goes directly to consumer. So I'm excited about that. I can't really talk about it too much because we're still in the development stage, but there's going to be great
Yeah,
news about that. So the future is going to be where now it's going to be in the patient's hands. So no more going to a doctor because you have to have these injections and stuff like that. It's going to go. You're going to listen to these podcasts and these shows and go online and go through ChatGPT and ask questions. And then it's what's going to say is, take this thing, has the same signals as this, as that. This is powerful. So regen will be that particular help for all you guys out there that need that tissue that heal, the arthritis that needs to get solved, all those things that you need to regenerate and make you feel youthful. It's going to come out right to your hands at a cost that's going to be so inexpensive compared to injection world.
that's amazing. I tell you, my man, and that's a beautiful one. Realizing a problem and creating the solution, not to extort the people, but to impact them. I love that, my man. That's a great one. So to bring this on then, Dr. Tammy, what would you like to leave the audience with, like a final thought? And to those folks who like to reach out to you, learn more about the wonderful stuff you're doing, make a purchase of your amazing book, or even ask you questions. How can that be possible?
Yeah, you can go for my book, you can go on Amazon and the title is The Future of Regenerative Medicine and just type my name, RHEE, and it'll point you right to it. And if you have any questions about regen, you can go to my website. It's RHEEGEN.com. And then you can kind of figure things out. Or if you have more questions, you can just hit info@regen.com and ask me a question. I think the big thing that I want to talk to your listeners is that the future of medicine is going to be in your hands. It's going to be a great opportunity to like really capture the intelligence and all this information that's going to be out there in the web and these shows that are giving you more power to your hands instead of having it in the pharmaceutical or the doctor's hands.
Amazing. That's so beautiful. So that's going to be the end of the show, Dr. Tommy. Thank you for coming and thank you for sharing this wonderful stuff with us. It means a whole lot. Thank you.
Thank you very much. I really appreciate it. This is a fun one.